Gathering the story. Block 4. Use open-ended questions. Using open-ended questions gives the patient an opportunity to speak. When gathering the story, there are particular questions you can ask to incorporate patient's perspective. How quickly do we interrupt our patients? Research indicates that, on average, we allow our patients to speak 11 seconds before we interrupt them. Back in 1999, research similarly was done, which showed on average we interrupt our patients in 23 seconds. This shows that we have a worsening trend in interrupting our patients. Once interrupted, only 25% of patients ever go back to finish what they were saying. If uninterrupted, how long will a patient speak for? Research has shown that on average, a patient will speak for 90 seconds. So let's give our patients those 90 seconds. While gathering the story, assess what the patient already knows. Determine their perspectives and worries. You can ask them questions like, "What have you been thinking might be the cause of your symptoms?" A patient's intuition may make your history-taking time much shorter if they are thinking what you are thinking. At the same time, you can reassure them about things you know they don't need to worry about. Knowing what they feel helps for a smoother conversation. What is the patient looking for? Understand their expectation. While gathering the story, ask them, "What are you hoping to achieve with your visit with me today? What matters to you the most right now?" Knowing patient expectations will help you efficiently direct your conversation to what matters to them and make patients feel heard while also saving time for yourself, as you will know what to focus on. Explore the impact of their symptoms. Understand the patient's perspective by asking questions like, "How have your symptoms affected your daily activities? How is your family dealing with this? How are things going at work?" Try to know how the illness is impacting their day-to-day life. To summarize, you can incorporate patient perspective by assessing what the patient already knows, finding out what the patient is looking for, and exploring the impact of their symptoms.